Hello, I'm Rafi Romano. I'm very delighted to present you in the next series of videos a wonderful buckle bracket that I'm using by ADENTA, the German company, named FLAIR. FLAIR is a self-ligating bracket that I want to use this opportunity to explain you what, at least to me, in my clinic and with my patients, what are the advantages with this bracket and what I'm really focusing when I'm choosing one bracket system over another one. The FLAIR bracket is a self-ligating bracket, of course, but we will try to see all the elements of the bracket, including the door, passive versus active, the material from which it is made, and prescriptions and other parameters of the bracket. If you combine self-ligating brackets that exist in the market, the main difference between one self-ligating and another is active versus passive self-ligating brackets. And we know that the passive self-ligating brackets has actually no active force to push the wire into the slot. And this can make a lot of problems when we have partial engagements, when we have alignment and the wire is not deep in the slot. So if it's not deep in the slot and we have a passive ligation, we actually do not have anything that helps us in the alignment of the teeth. Now, there are many, as you can see, many variations of doors or clips that that actually grab or hold the wire in the slot. If you look at passive self-ligating door, you can see that what we get is binding of the wire in a very traumatic way, which can cause many things. One, permanent deflection of the wire. Second, some binding and friction that do not let the teeth move. Excess of force, which can cause pain and root resorptions. And also difficulty to engage the wire in such crowding when you have to bend the wire so sharply. The difference in passive self-ligating, that all you need to do is only partially close the door, and then the door, the active door, is actually pushing the wire continuously during the weeks after we see the patient into the slot. And this makes the activation not only during the patient is in the chair, in the clinic, but also during the whole time, slowly, without pain, in a very biologic way. Now you can see here that when we put a round wire in the active slot, it actually has no friction, same as we see in other self-ligating brackets. But when you put a rectangular wire, what happens is that we get the torque gradually. We don't need either to bend the wire and push it into the slot immediately, which can cause a lot of problems. And we don't need to worry about the fact that the wire is not fully engaged in the slot. It happens slowly and continuously during the treatment. Another feature of the FLAIR bracket is the option to do half ligation. We can use only the mesial or the distal part of the bracket, close the door, and leave the wire outside of the slot. So in that way we get the overcorrection of the rotation very quickly. In one visit you can actually finish all the rotations we had to do for a specific area or specific tooth, and then put the wire inside the slot, both mesially and distally, close the door, and continue the alignment. All these features are combined in a bracket which is made in one piece by CNC machines. We get expression of all these features in a very small, narrow and flat bracket, regardless the fact that it is self-ligating. We don't see a lot flat self-ligating brackets as the FLAIR bracket. This also gives us a more force control, because we are more close to the center of resistance versus other brackets where the self-ligating mechanism is away from the center of resistance of the tooth. You can see here the opening and closure of the FLAIR bracket. It is done, you don't need a special tool. You can do it with an explorer. You can do it with any sharp appliance. You just put it inside the hole, twist your hand to open and twist your hand to close. This is a procedure that takes to you or to your staff no more than a few seconds to change wire in a complete arch. Having experienced a lot of self-ligating brackets, I can tell you that opening and closing is probably one of the most important things in self-ligating brackets. You can see also that in a complete arch, all this is done very, very easily and quickly. This tool that you see here is a special tool that you can actually buy from ADENTA when you buy the FLAIR brackets, which can be in your clinic dedicated only for the opening and closure of these brackets. You can see that comparing to other brackets, the FLAIR bracket with all its elements, including the base, which is in one piece CNC made, we will discuss the CNC method in the next lecture. You can see how narrow it is and how flat. And with the accuracy of the manufacturing process, we get actually precise prescription of exactly what we have planned. In most of the brackets that are investigated in the literature, you can see a huge difference between what was promised and what actually was measured. And in the FLAIR bracket, as like in the most ADENTA brackets, the manufacturing is done by CNC, and therefore the accuracy is maximal. Thank you very much, and I will see you in the next part of the FLAIR presentation. Bye bye.